If you have any questions about how to best prepare for your hip or knee replacement surgery, I would suggest you address that directly to your surgeon and their team.
So within 24 hours prior to orthopedic surgery, you should have received a phone call from your hospital letting you know what to expect when you arrive, what documents to bring, and who should accompany you to the hospital. Included in this phone call, they will also advise you on what medications to continue versus discontinue.
The vast majority of patients we encourage to hydrate liberally, meaning we encourage them to drink water and other clear liquids up until the moment they leave their home.
It is important to prepare your home for coming home after surgery. We do recommend that you remove any slip rugs from the house. If you have an animal at home, whether it be a dog or a cat, that you might want to have your pet stay with your neighbor until you start to heal and you're better on your journey. The reason being is that you wouldn't want for your pet to trip you up in any way or to slip on any rugs that are at home. You really want to take a moment to look at the space and ensure that it's free of clutter to help you in your healing process.
These days, our average length of stay for a hip replacement is less than 2 days now, which means a good percentage of our patients are going home on the day of surgery. And for knee replacements, it's just slightly longer because of slightly increased pain that they might need to have managed. But that length of stay is also approaching 2 days.
If a patient has more questions about their joint replacement recovery, I would definitely defer them to their surgical team as well as their surgeon's office to get those questions answered.